So welcome everyone. Tonight we're going to be doing a little bit of focus on goal setting. And as we said, it's the start of the year. It's a really good time just to kind of really stargaze ahead and look at what the year ahead is going to look like. We'll have a little bit of a chance to look back at some of the things that we might have achieved in the last 3 months. Some of you might be, at the start of your journey, some of you midway through, or some of you even, close to your goals. So it's no matter where you are in your stage, it's just a really good chance to look at what are my priorities, my values, the things that I really want to be focusing on in this next, we'll say a year, but really we're going to kind of break it down into 3 months. And as we said, when the tennis is done, when Australia Day is done and the kids are back to school, it's like, all right, we can start life again and life is getting back into routine. So without further ado, I'm just going to do a little bit of a screen share and hopefully you guys can see that. Um, so we're going to look at a bit of an action plan for this year so that you can get about living your best life. And oops, that went ahead quite a few. Um, so we'll take a little bit of a look, as I said, at what have been the things, what have been the wins over the last 3 months or so. Some things that have gone particularly well for you. We'll also be having a bit of a look at maybe some of the challenges that you might have already overcome in the last few months, and importantly, the lessons that we've learnt. And then we'll get about sort of looking at our goals and where we're heading to in the next 3 months. I wanted to bring up this. This is what we call our blueprint for health at Alivia. And even though it's called Alivia Medical weight loss is not the goal. Your overall health and well-being is. We know that that comes down to eating wisely. When we focus on our nutrition and get that right with nourishing foods that are portioned well and that fits in with our particular lifestyle, that's probably one of the key foundational points of good health. Nourishing the body. So that's about physical activity. So moving and grooving in whatever way you choose to do that, whether it's Zumbaing or gardening or walking or running. Building strength. We know that building muscle mass is really important for our longevity and prevention of chronic diseases. But also, it's not just about getting stuff done all the time. We need to have periods of rest and play in there as well, and things that replenish our bodies and our souls. And of course, the next element is nurturing the soul. So it's no good having a great, physical body unless we've got that sense of connection with people around us, that we're living a life with purpose, and that we take care of our mental health. So we see that as the blueprint for good health. And we'll come back to that throughout the night as well. But you might already identify some of those areas where you go, think, tick, yeah, I'm actually doing quite well in those areas. And you might already be thinking, you know what, I might need to be focusing on my mental health this year, or this is a year for me to really focus in on my nutrition and how I can improve that. And then, yes, of course, we're here to lose weight, but why? Why is it losing weight to get to a number? Is it losing weight just for the sake of it or to fit into a dress? What I wanted to show you this, which is the benefits for on health for weight loss. And so the thing is, when patients come to see us, they're very often saying, I want to lose 20, 30, 40, 50 kilos. I want to get back into the size that I was when I was 18. And really we want to look at what amount of weight loss is required to improve your health. So health is one part. Um, and so it's not that much is the answer for health improvements. You see, with as little as 3% body weight loss, you already get dramatic improvements in your blood sugar levels. You start to see improvements in high blood pressure. When you get to that 5 to 10% weight loss, we're seeing cholesterol improve, and women who've got PCOS, they start to get improvements in their periods and regularity and fertility. Fatty liver starts to improve, and prevention of type 2 diabetes. When we get sort of that 10 to 15% weight loss, osteoarthritis tends to improve, going from the bottom up. Reflux, obstructive sleep apnea, NASH's hepatitis due to fatty liver, urinary incontinence, and cardiovascular disease. And then 15%, that's when you're starting to get some really big health changes like type 2 diabetes going into remission, or improvements in mortality, in other words, not dying from heart disease and heart failure. So you don't need a ton of weight loss to see health improvements. So I'd encourage you to think tonight about what does 5 to 10% weight loss look like for me? What does 10 to 15% weight loss look like from where I am now? Because that's when you can expect to see a lot of these health benefits kicking in. All right. When we're thinking about setting our goals, we want to focus on things that have a really big impact and are going to make the biggest difference to your health and your well-being. And so we've got this what's called our fix this next framework, and we start from the bottom and we ascend up in the layers as we've sort of covered off the foundational levels. But you'll find that you'll probably iterate this time and time and time again. So you'll probably feel like, you've got your foundation levels right, you've got your nutrition right, then you're moving on to sort of getting physically active, but then your nutrition needs a little bit more attention again, and then you can kind of go on and move back into your patterns of exercise. Then you're focusing on your mental health, and then when you're really feeling fantastic, then you've got the ability to have an impact on your your health changes are going to have an impact on your actual health. You're going to have more freedoms to do the things that you want to. You'll have a positive influence on your friends and your family and your wider community. So we're going to start down at the bottom and ascend our way up through those layers. And in our initial assessment, when you come in for your first consultation, we'll often be covering off on these things, the assessment. Where am I now? How much is genetics a factor in my weight and my health? Looking at your family history and who might have struggled with weight in your family. We would have assessed any conditions or medications that contribute to weight, like thyroid conditions, polycystic ovarian syndrome, perimenopause, menopause. It's all these things that affect the women, isn't it? um, or injuries and these sorts of things. We'll be assessing, is there any complications of weight gain, like type 2 diabetes or fatty liver or blood pressure and those elements. And then we'll be looking at those goals and motivators at the end of that consult. The most impact on your weight, and I'm saying weight because weight is not the whole part of your health, but the most biggest impact on your weight is going to be by focusing on the area of nutrition. And what we try and do with you is to focus on controlling hunger and cravings first of all, so that it's possible that then to put into place a really good dietary plan that's going to help you to achieve your health goals. So focusing on nourishing foods, high protein, low carbohydrates, foods that have got plenty of vitamins, colorful foods. We call it, high volume foods. You can have plenty of steak and salad and vegetables and fruit and grains in moderation, but we try and trim the excess. We look at what are the processed foods and the I guess packaged foods that and our sweet treats and those sorts of things that might be contributing to a calorie excess. We look at portion sizes, and then all importantly, we look at managing your food environment. So it's really well and good to say, here's a bit of a dietary plan to follow. But if there's chocolate cake, as there is in my house right now after a birthday, or if the fridge is full of, goodies, or you open the pantry and there's the chips staring at you, that makes it really hard. So I'd encourage you to really have a look at this layer as maybe one of your goals. Physical activity, that's about, getting moving, getting your body active through cardiovascular exercise or dance or gardening, or there's a range of things, and we'll touch on those. Building strength, doing some resistance exercises a couple of times a week, finding ways just to increase your incidental activity. So that might be that you're, walking to work, or you are putting your pedometer on and measuring your steps for the day and aiming to increase that each day. But maybe you're doing all those things and you actually need to build in some times for rest and play and downtime to replenish your physical body. And also importantly, managing alcohol and other drugs. So it's all well and good to look after our physical body, but if we're introducing toxins into our body, that can really wreak a bit of havoc with our physical and mental health as well. Or maybe the area that you're looking to focus on might be around your mental health. Um, and so that might be looking at, are there mental health conditions that I need to address? Is it more around managing emotional eating? So is it that I use food as a strategy for coping with some uncomfortable emotions? And do I need to get more in touch with what those emotions are and to name them and to experience them and to work through them with the support of a coach or a psychologist? Um, Sometimes we get so busy in just doing life that we forget to do things that bring us joy and purpose. So if you're managing your physical health, your nutrition, your physical activity, but you're still feeling a bit, what's the point in life? Then that might be really getting back in touch with the things that bring you joy and purpose, because that brings a sense of fulfillment. And when you're living, when you're being the best version of yourself, then that's what brings about that sense of mental health and well-being as well. And when we're doing all of those things really, really well, then we can feel, it's like Maslow's hierarchy of needs. We need to, cover off on our basics before we can then start having an impact in our world. And, many of the patients that I've seen now have the ability to do the things that they want to do. They're playing soccer with their kids and running around on the oval. They're going traveling and don't need the extender belt anymore to be able to sit in the aeroplane seat. They've inspired their family, and their family members are now starting to, make health a priority for them as well. And they're able to have a bit more of an impact in their communities. So that's our hope and desire for you, is that through this process, you can start to live your very best life, to enjoy, yeah, all the things that are important to you, and to be, yeah, sharing that with your friends, family, and community that are important to you. All right. So let's have a look at maybe some potential goals that might apply for some of these. So um, actually, I'm going to do this a little bit. I'm going to do this a little bit back the front. What I'd like to do, first of all, I wonder how many of you have got a piece of paper and pen handy by your side, or some digital tool for writing some of your goals down in. Do you want to drop a yes in the chat, or just a raise of your hands if you've got some of those handy? Yeah, we're looking good there. Fantastic. So what I'd like you to do is to have a little look back over the last 3 months. We're always eager to look forward and to set our goals, but it's really useful to look backwards first of all, because I think as human beings we're like, I've got to do more, I've got to be more, I've got to achieve and produce and all those things. But what I'd like you to look back and is to see what's gone really well for me in the last 3 months, particularly in relation to my health and my weight. But you could also, if there's other things going on from a personal perspective that have gone well for you, you can mention those as well. So I might just give us a couple of minutes on the clock, just to look back and reflect on what's going well for me in my life at the moment, particularly in relation to my health. Just put on a little timer for us. All right. And then looking at that same 3 month period, um, it's great to recognize the wins, but I'm sure there were challenges as well. We had Christmas and holidays and those sorts of periods. That can sometimes make it challenging to manage health and weight. What were some of the challenges that you faced and had to overcome? And then importantly, what did you learn from those challenges? And I'll just get you to spend another minute and a half on that. And what I might do when you're ready is just open it up to the floor to see if anyone would like to share some of their wins or some of the challenges that they were trying to overcome over that period. Because the learnings that you get from those are really important to sort of carry forward into this next 3 month period. So would anyone like to share? There's no obligation to. Oh, Nicole, I think you're muting, but I can't hear you. Let me see if it's... No, I've got my volume up. Can't hear you. Okay. Thanks for sharing. Thanks for being willing to share. Might be your connection. Anyone else? Kate, are you trying to...
Can you hear me now?
Yeah, yeah, perfect.
Okay. Um, I've had a neuroma in my left foot, which has caused me considerable pain
Yep,
for nearly 12 months.
yep,
Um, and I've had chronic pain in my right knee for 10 years, 12 years now,
yeah.
which has um, challenged my ability to exercise in any way, shape, or form.
Mm,
But the neuroma, that was starting to get better. And then this neuroma just put it all back again, and I couldn't do anything.
yeah,
But I've had some treatment on it a week and a bit ago that I think I'm almost brave enough to say that I think it's working.
yeah,
That I may get some pain relief and be able to actually walk the dogs without pain,
yeah.
which would
So,
be quite something for me.
what impact did that have on you? Like the pain in your knee and the neuroma, like
Um,
emotionally, physically, or mentally?
uh, Physically, that it was painful to put my foot to the ground. It was painful to walk, get up out of a chair when I'd been sitting there for 10 minutes. It would be really painful.
Yeah.
Um, and emotionally, it set me back
Mm,
from thinking that my knee was better and I could start doing all this exercise again and start actually, enjoying life.
yeah.
That, oh God, here I go again.
Mhm.
Um, I found that really hard.
Yeah. Yeah.
And starting to come out of it again now is sort of thinking, oh, am I brave enough to say that yes, no, yes,
Yeah.
it's improving. Yes, I may get some mobility back and be able
Yeah.
to chase the latest granddaughter when she runs away from granny.
These are the things that are important. Don't worry about blood
But
pressure. Can I chase my grandchild? Make sure that I can
yes,
how to get her down. I
yeah.
love that. Um,
Yeah.
well, you talked about those mental expectations. Like, the one
Yeah.
thing is physical those are the limitations. What I will say, and you saw that from the Fix This Next framework, is that, you're focusing on nutrition, you can still have a lot of wins there, even if you can't exercise. So
Yeah.
that's a reassuring thing, is that you can still have a really big impact on your health by focusing on nutrition,
Yeah.
until you get those other issues sorted. So I'd encourage you to kind of say, what's in my control now? I'm going to focus on
Yeah.
that because the body's not behaving how it's meant to, or how I want it
Yeah.
to behave.
Yeah.
And then you'll step through what you need to do to get those things sorted. Um,
Yeah.
and then it's just helping the mind to readjust and go, okay, so I thought it was going to be, I'm back to exercise now, but it's not. Where can I
Yeah.
put that energy now? Um,
Yeah.
just reframing it.
I
Um,
think also for me, I'm trying to um, change in my head the word exercise to moving around and doing things that I want to do.
Move and
Like,
groove, honey.
yeah, that it's um, not a formal exercise type thing, that
Yep.
I have to do this,
Yep.
you know, 5,000 or 10,000 steps a day. It's
It feels
just
arduous to do
trying.
that, doesn't it? It
Yeah.
feels like a job to do and something to get done and
Yeah.
feel. But yeah,
Yeah.
it's about, I'd encourage you to think about, how can I waste energy today?
Yeah.
I'll never forget, one of my patients said, I fold the washing now and I put one piece of washing away at a time. I fold a piece of washing, I go and put it away, and I come back.
Yeah.
So they were, just wasting energy. They could have folded it all and then go put it away in one go, but they
Yeah.
did it bit by bit. And it might be, that you're, yeah, getting out and walking in the garden, or,
Yeah.
aiming to, do a few squats when you're doing your brushing your teeth. There's lots of ways to be
Yeah.
physically active. And if
Yeah.
you think about our hunter-gatherer ancestors, they were just on the go all the time. They weren't
Yeah.
sedentary. They were just finding ways to, well, they burnt energy. That's why our bodies are really good at trying to conserve energy, because if we lose too much energy, then we're going to die.
Yeah.
So the body goes, oh, how can I conserve as much energy as I can? And how can I put some in reserve, in other words, in our fat stores, to make sure that I can survive the next period of famine? So your body's trying to help you out. It just hasn't adapted to the fact that it's 2026 and there's no
Yeah.
famine coming anytime soon. Yeah. Um, Thanks for sharing, Kate.
No
Anyone
problem.
else want to share? Nicole, have you managed your tech issues now? Nope, still no voice. Okay, that's all right. Anyone got any wins? Oh, you can type. Yeah, feel free. Yeah, let me have a look. Ooh, oh, Nicole. So positive, my Alivia doctor diagnosed vitamin B12 and D deficiency. Now treated, you've got more energy. Negative is that you still have health issues that are being diagnosed and it's exhausting. Yeah. Okay, kind of shows you that life is not a straight line when it comes to health and with weight. You don't go, oh, I'm going to start here and I'm going to get to my goal weight here and it's all going to be a straight line. It's sometimes a little bit, like this, where, okay, I'm all right, well, it's useful being under a doctor because you can start understanding what are some of the physical things that are getting in the way and correct those. But there's still a few other things to work out. So I again encourage you to focus on the things that are in your control. What can I focus on whilst I'm getting these other things diagnosed and sorted? Um, yeah, you've been trying to do that. Yeah, yeah. Sorry, we're a little bit limited by not being able to have the conversation. Sorry, Nicole. Great. I'm going to volunteer. I have not been drinking for 2026. Got into a bad habit of having a drink of wine for, it was just, dinner time. Oh, have a glass of wine, and that became just a habit. And so I thought that's one thing that I'm just going to tuck away and just, really examine, how much of this is habitual and how much is needed. It's never needed. But yeah, that's been really good in terms of just more energy and more clarity, and I just feel more in control as well. So that's been a good positive. And I've been doing strength training twice a week, which feels really good. Yeah. Anyone else want to share some wins? And you're moving much better. Well done, Nicole. Excellent. All right, what we might do now, not suffocating bending over, that's always good, isn't it? being able to tie up the shoelaces, being able to bend over without get squashed. It's these small things that actually are the most meaningful impact, I think. As doctors, we think about outcomes from health conditions, but it's actually the how does life get easier? I've got more energy. I'm not as breathless. I can bend over easily. They're the things that really make a difference. Um, all right, let's go back to our presentation. Okay, so what we might do, let's have a look at why goal setting is important. Um, I think when we set goals, we're actually making a commitment. We're saying this is what I want for my life, and this is what's important to me. So we're actually kind of committing. And when we put something out into the ether, your brain is already kind of getting ready to make it come true. So that commitment is one thing. Um, and I'm just going back to yeah, sometimes we don't do goal setting because we feel like, oh, well, if I set some goals, then it's going to become really hard work. Like, oh, if I say I've got to exercise, 3 times a week, and what if I don't do it? And I've got all this hard work ahead of me. The other thing that can happen is we're afraid that if we set our goals that we might actually fail. If I don't put it down, then it's okay if I don't make those goals. I haven't really committed to it, so it's okay if I slip up. But when we do set our goals, we actually get a clear direction of where we're going. We're really highlighting what's the top priority to focus on, because as human beings, we can have 100 different priorities, but you're not going to make any of those things happen. But if we set some clear goals about what we do want to achieve, we can prioritize the things that are important to get done to help us to reach our health goals. It also helps us to look back. We just did that exercise, about where was I 3 months ago, and what have I improved on, and what are some of the challenges I'm overcoming. It helps us to sort of look back and track our progress and course correct if we need to. Well, I thought I was going to be here in 3 months' time, but I'm a little bit off track. What do I need to fix, modify, add, delete to help me to get to where I want to be? And there you go. I was anticipating my own answer. Course correction. It allows us to adapt and to make changes to our plan if we're not getting to where we want to be. And ultimately, we set our goals because we want to help you to live your best life. We want you to be, it's not about what's a priority for us. As I said, we might have from a doctor's perspective, some of the health goals with him would be good for you, but it's important for you to identify what are my values, what's important to me, and why are these things important to me? It's your personal why that's going to drive you to reach your goals. It's going to allow you to say no to something because there's a bigger yes that you're saying yes to. Okay. Um, all right. So, what I'd like to do is to um, have a little look at, I'm going to stop that one for a moment. I'd like us to have a little look at what our goals are going to look like over the next 3 months. So, we did that little intro at the start where we looked at the Fix This Next framework, and we looked at the areas around nutrition, physical activity or moving and grooving, and our mental health. I'd like you to really have a think about in those 3 areas, what are some of your goals that you'd like to sort of work towards? And I'll go back and do a little bit of a share about some of the potential goals that you could look at, but these are just a bit of an idea starter. Yours are going to be different. So around nutrition, it might be that you're aiming to sort of drink more water to help reduce headaches and constipation, and you might be aiming for sort of 2 to 3 liters a day. It might be that you're focusing on a bit of a calorie count. We're not big advocates of calorie counting. We prefer you to have good control of your appetite and to eat intuitively. But it might be that you're setting yourself a little bit of a calorie limit, and that could be to track that through MyFitnessPal. It might be that you're really aiming to improve the amount of whole foods that you have in your diet and limit anything that's in plastic packaging or processed foods. That could be aiming to get your 5 serves of veggies in per day. And we know that the colourful range of vegetables are best. So, a range of what I call rainbow veggies. Are we getting some carrots and some cucumbers and some red capsicum and other vegetables into our day? A really good one would be, can I hit my protein intake goal for the day? and aim to have protein at every meal. Protein being naturally filling, it's also good for building muscle mass, and it helps to control appetite and build muscle and therefore our metabolic rate. If you're struggling with treat foods or discretionary foods, maybe we're aiming to stick to, say, half a cup of treat foods twice a week so that they're not eliminated altogether, but they're in there in a really planned and manageable way. Or if having takeaways your thing at the moment that you're struggling with, maybe we're aiming to limit that to say once a week. And there's a great resource in the members portal on healthy takeaway options for takeaway. Um, so let's have a think about maybe what some of those nutrition goals are as our first step, and I'll give us a couple of minutes to note some of those down. All right. What, do we need any more time on that one, or are we all good? Thumbs up if you're all good. Yep, great. Okay, let's turn our attention to our physical goals. So we've covered off on nutrition and where our focus needs to be there. How are we going with our levels of physical activity at the moment? And remember, being physically active is about feeling good. All right. So, being physically active is great for your mental health. It's great for your physical health. It helps to reduce blood pressure, improve osteoporosis, reduce our risk of heart attacks, improve insulin resistance and diabetes. Um, and physical activity, we conjure up these images of, doing sweaty workouts and being, disgustingly, grossly, sweaty and all that hard work. But it doesn't have to be. It really, I want you to turn your attention to things that you enjoy doing. And if you don't enjoy physical activity at all, then maybe it's thinking about what are the things that I least hate doing, because my body really needs to get moving. And when we think about incidental activity, which is, as I mentioned before, finding ways to waste energy. Cardiovascular fitness or moving and grooving, that's things where we're starting to get a little bit of a huff and puff. Could be gardening, dancing, walking, running. It could be netball or what's the pickleball's the flavor of the month at the moment. It could be running around with your grandchildren. It could be, yeah, anything where we're starting to get a little bit of a huff and puff and struggling to talk as we're exercising. One of the really important, the other third one would be strength training. Now, if you have low muscle mass, you are much more likely to get sicker when you're older. Um, if you have adequate muscle mass, it builds your metabolic rate. You are 57% 50% 7% less likely to die prematurely. Can you believe that? Just by having strong muscles. It helps to improve conditions such as dementia. It helps to improve asthma. It helps to reduce the risk of osteoporosis and osteopenia, diabetes. It actually helps with every part of our physical health and well-being. So strength training is really important. Um, so so is your focus on finding ways to have more incidental activity into your day? Is it incorporating a little bit of cardiovascular exercise into your week? Or is it incorporating some strength training into your day through Pilates, yoga, gym workouts, something where you're doing some exercises with resistance, maybe against your own body weight, or in a gym or with a PT? So I'll give us a couple of minutes now to write down a few. Oh, it doesn't have to be a few. It could be what is out of all those things, what is some level of physical activity that I can commit to in the next 3 months? What do I see being achievable? Don't set yourself to do a marathon if you've never run a day in your life. But it might be that commit to doing 3 walks a week, 20 minutes a day if you're not already doing something. And if you're already doing that, maybe you start to increase the intensity of those exercises. Just so you know that you're in good company. For the first time in my life, I've been consistently doing strength training and I feel fantastic. And I committed to doing some running as well. And each week I rock up and my trainer says, "How's the running going, Catherine?" I'm like, "Oh, I haven't done it. I haven't enough time. I've been too busy, blah, 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 all the excuses." And yeah, but I'm feeling really good that I'm doing something, right? So I'm happy with that and I'm accepting that I've got limitations. I've got 3 young children and running a business and all these things. So um, something is better than nothing. And there's these recommendations around, 3 to 4 days a week of cardiovascular exercise, 2 days of strength training, and having lots of incidental activity. But you've got to look at where am I now and what can I realistically achieve, and then solidify that. And then you can look at the next level that you add on after that. Okay, so we don't expect perfection. All right. And then we're going to turn our attention to our mental health goals. So the things that help us to nurture our mental health and well-being. So I'd like you to reflect on what are your goals in this area. Have you at the moment got habits, activities, groups that you belong to, or things that give you a sense of joy? Um, I'll never forget one of my patients I consulted with, and because of her weight, she'd really withdrawn from a lot of the things that gave her joy. And when we were talking, we spoke about what are those things that you want to get back to. And she said, "Oh, I love singing, Catherine." And I said, well, let's find some ways to do that. And she lost a few more kilos before she was ready to do it, but she went and joined um, a I don't know what it's called, but basically a night where you get up there. It's not like karaoke, but something similar, stand up mic, and you got up there and did some singing, and it just brought her so much joy, and she'd forgotten those things that were really important to her. Um, yeah, so have a think about what are the things that are important to you that give you joy, that you want to make sure you're incorporating into your life so that you've got balance in your life, and it's not just about all work. Another patient said she loved doing the family history and genealogy, and that was really good. Others have said that they have enjoyed doing the crystal art making. For me, it's connecting with my girlfriends and having some time with them and going out for walks. Um, Someone else said that they wanted to record a duet. I thought, fantastic. So these are just some sample ideas, but I would love you to sort of make note of what's important for you in your mental health. Okay. What I'd like to do now is just open up for a little bit of sharing about what are some of the things that you've identified are important for you in the next 3 months. And again, there's no obligation to share, but you know what? When you put it out into the group, you might find that there's some support from the group to help you to reach those goals and accountability. Um, but nonetheless, it's just really good to sort of yeah, for us to be on the same page and for us to witness each other's goals and be in support of that. So who'd like to share first?
I can probably give it a go.
Thanks, Naomi.
Um, so I too have just started strength training. And have been given sort of the recommendation of the strength training 3 times a week, and then the cardio program for 2 days a week. So one of my goals is certainly getting consistent with that and sticking to it. So
Yeah.
see how that goes. Well, make it happen, I guess. And
Just
one
on
of
that,
the,
Naomi, can
yep.
I just interrupt? When we're setting goals, and I haven't touched on this yet, but it's really good to think about if I'm setting that goal, and it's very likely that was like my running that was set that goal in the past, what are the things that were going to get in the way of that? And what are some of the things that I can put in place to help me to be more likely to achieve those goals? So is it diarising it? Is it having an accountability partner? What do you know you need to help make that happen?
It's a really good suggestion.
Mm. Yeah, you don't
Yep,
have to answer it now, but something to
yep.
think. It's a sort of a deeper level to our goal
Mm,
setting. Yeah,
mm. Just might make a note of that.
yeah. Oh, she's a fast typing. And sorry, I interrupted you. You're going to
Oh, and
say
I was
something.
just saying, oh, one other thing I've started to do, and I'm not convinced that I've got quite the right app, but because I'm quite sedentary at work, I've put on one of those stand-up reminder apps just
Mhm.
to where you can set reminders to stand up and
Yep,
move. So yeah, yes,
great.
not quite working as I want it to, but I'm going to try and stick with it a bit.
Yeah, the other one is the 7 minute workout app.
Okay.
For maybe I should follow that myself. People who are time poor, if you've got, if you are sedentary, we do need to be physically active to get the brain going once again. So it might be that you carve out 7 minutes and, it might be that you're doing ice skaters, or if your pelvic floor can hold up, some star jumps, or it might be there's some little things you can do in there just to kind of keep your body moving.
Mhm.
So yeah, reminders to get up every hour, or if you're needing to go and rather than sending an email, you go and talk to the person who's in the next cubicle, or yeah, go and get that glass of water from the tea room. Yeah, or you. I'm just thinking about how many toilet breaks you can fit in the day.
Yes.
Yeah, well done, Naomi. Thank you. And we've got Vicky said, I'm going to drink more water. So Vicky, if we think about SMART goals, we want to make them specific. So rather than more water, how much water would you like to be consuming per day? What's recommended for you? And it's generally going to be sort of 2 to 3 liters. Um, and then once again, looking at, well, what's going to help me to get there? Is it have I got my lovely water bottle next to me? Have I got the reminders if I forget? What kind of gets in the way? Do I need to have water with a little splash of, low jewel cordial, or do I need to have some flavored water to make it more enjoyable, or hot water? Like, just try and think of all the things that have got in the way of that already and how you can troubleshoot that. Nicole, yep, pickleball, yep. See, I knew I was onto something hip there. Learn how to play pickleball. I love that. Like, it's just that's going to be a fun way to stay active, right? Um, it's true. One of my patients said that she was Zumbering her way to good health. She was booty shaking to lose weight, and I'm like, you go, girl. You have fun doing that. And strength training, you won't regret it. It feels really good and it's great for the body. And then look at eliminating gluten and dairy to improve inflammation. Works well with you with Hashimoto's, and talk to Dr. Nikki or the nutritionist. Yeah. Um, okay. Yeah. Seek some advice about that. I won't give medical advice, even though I'm a doctor. I don't know your full history. But yeah, seek some advice about that. So inflammation could be if you've got a food intolerance. I'll speak in general terms now. If you've got a food intolerance, and that will certainly inflame the gut. But also, so does carrying excess weight. So as we decrease weight, we decrease inflammation in the body. Low carbohydrate eating, low processed food eating really helps with that. But there might be those specific food intolerances, so it's worth, doing testing for that if needs be, or doing an elimination diet and under care of our dietitians, and they're skilled in that area. Great. Who else have got some goals that they'd like to share? Or who else needs some support with some goals that you really like to, hey, I think I want to do this goal, but I've tried and tried and tried in the past, and I need some ideas. We're here to help.
I think I want to get out and start walking more with my dogs. And Pippa's, my Groodle, has been accepted. She's doing therapy dog work um, with an aged care facility once a month. So
Great.
being part of that has spurred me on to do more work with her and do trick training and stuff with her, and which all is, it's not super physical, but it's still moving. As you say, it's moving and grooving. It's not,
Yeah.
and hopefully I can get back on the exercise bike when my foot is, when I can safely say my foot is improving. I'll get back on the exercise bike for the other
Yep.
part of doing a bit more cardiac stuff.
Yeah. And just remember, it might be that your knees or your foot's giving you grief, but then you've got your upper body stuff as well. Or it might be
Yeah,
that you need to adapt and do some non-weight bearing exercises, like doing some aqua aerobics. And so
yeah,
have to adapt to kind of what's happening in the body and say, well, if I can't do this, I can do this, or I need to
yeah,
do some other form of exercise in the
yeah,
meantime. Yeah.
yeah.
Nice, Kate. It's good to have a doggy, a good excuse for exercising.
Very much.
Good luck with that. Anyone else have any goals that they wanted to share? Elise, I feel like you've got something to say.
Yeah. I keep going, oh, should I say anything? Should I not? I really want to get back into swimming again. I used to love swimming and I haven't been swimming for ages.
Yeah.
So like do that 3 times a week. I've never really done any strength training, so I'm not kind of sure where to start, but I'll, you know,
I'd probably have a session with the exercise physiologist.
yeah.
So we've got, who's your regular doctor? Which location do you attend?
Wanturna?
Yeah, yep. So
Yeah.
Sammy Delapis is the exercise phys. He's there every second Friday. Or you can actually go and see the Keyser team at one of their other locations as well. And they can
Yeah.
either put together a home-based program for you using your own body weight or some, simple weights at home. Or they can show you how you can do strength training in at Keyser. I
Yeah.
find the strength training at Keyser fantastic. Two reasons. Number one, you've got someone there who actually pushes you, and if no one's pushing me, I'm not working hard
Yeah.
because I'm not going to be a taskmaster for myself. I'm doing the least work that I possibly can.
Yeah.
But also the accountability of showing up because someone's expecting me there. I've found that that's what I need, because unless I've got an appointment, I'll find a million other things to do. And
Yeah.
and also the third reason is it's done in half an hour, which I like the time
Oh,
efficiency of that.
hello.
Yeah. Yeah. And 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 when you're doing strength training, you actually have to keep progressing the intensity of the exercises to actually get the benefits. Whereas with yoga and Pilates, you're going to reach a capacity, like a potential. You've got a potential to gain X amount of muscle, and then you're going to reach capacity because that's all your body weight will allow you to do. Whereas
Yeah.
on their machines, they keep kind of building it up and building it up, but not in a way that feels overwhelming. And I don't ever come out with drenching sweaty hair, which is really important.
Yeah. Excellent.
Yeah.
Yeah.
So yeah,
So,
touch base with the exercise phys. They can give you a bit of support. Nicole's seen Sammy. Yeah,
yeah.
great. Yeah. Keys is not cheap. But I like it because of the accountability. And so this is about finding out what's going to work for you. So home program all the way. They're there
Yeah.
to give you support in whatever way works for you, whether you want to do it at home or something you can do with a PT or in your other gym or Keys, like they can cater for everything and everyone.
Okay, great. Thank you.
You're welcome. Um, who else? Sharon, do you have something to say tonight?
Not really. I just feel like I need to get back on track. I haven't been on track for a couple of months,
Uh-huh. Yep.
and I've just started strength classes twice a week,
Good.
and I start back my art class in 2 weeks' time
Yep.
for relaxation,
Good.
and I've just got to start the eating properly again,
Yep. Out of all
and
those things, which one needs to get back on track the most? Where do you think?
everything, the food.
Yeah, the food.
Food,
Yep.
I'm just eating whatever, and I know it's not I know what it shouldn't be what I'm eating. I'm just not planning. So I've
Yeah.
just got to go back to my once I plan, I'm fine, I'm really good.
Okay.
But
So
and I
that's
do walking. I do walk 3 times a week. I'm doing that part. I'm just not doing the food very well.
yep.
Yep.
Okay, so the planning is where I want you to start, because
Yep.
sometimes when we're trying to get back on track, there's like, I've got to do everything. Just start
Yeah.
with planning.
Yep.
That's probably going to have the biggest impact on all those other things. If you
Yep.
can
Yep. I
commit to
think
doing
so.
a plan for the week,
Yep.
map out your meals, get your shopping done, you've got your healthy foods in the house ready to
Yep.
go. Then that's going to set you up for success, I
Yep.
think.
Yep. I definitely slipping. So I need to just slip back again.
Yeah, yeah,
So yeah, I
fantastic.
just need to plan. Once I plan, I don't go off track once. If I've planned, I won't do it if I know. But if I haven't got it planned, then I just do whatever.
Yeah, yeah. It's too easy
Yep.
to slip, isn't
I
it?
just need to pull my head in. Yep.
So I wonder what it would be like if we've set these goals and you've got your touch points with the doctor or the dietitian or the exercise physiologist, you've got their expertise. What would it be like if you had a health coach who was there to help you to keep your accountabilities to these goals? Would that be helpful?
Cooking your food for you.
Ah, you want a chef? Oh,
Chef.
haven't got to that point yet.
Just do pass me what I'm the right amount and when I'm in what I'm meant to do, then I'll be fine.
Look, I'm still searching for one here. I'll let you know when I find them.
I have my husband who does a lot of the cooking and
Yeah.
it's debatable. So
So
it's hard.
one of the things that, this year actually we're obsessed with finding out ways that we can support you guys better to help you reach your health goals. And one of the things that we're looking at is getting a health coach who can help you to identify your health goals, help you to do a little bit of coaching and accountability on those goals as well. Support for when you're falling off track, like, how do I get myself back on track again? Yeah, I just need someone who can, touch base with me and say, hey, how you're traveling with what we talked about last week. Would that be
Mm.
helpful? Yeah,
Yeah.
amazing. All right. Well, stay tuned. I would say within the next month, we will have that person ready for you guys because we really want to do whatever we can to help you reach your health goals. And we know that weight loss is not easy. And the more support you can get, the better, I think.
Yep. Very
Yeah,
good. Thank you.
you're welcome. Um, as there, I'll just pause that, finish our recording now, but